Welcome to Insight, produced in partnership with WDSC WRPT in Duluth, Minnesota. Today we are chatting with Dayle Patterson, CEO of the Lake Superior Community Health Center. Dayle has generously agreed to share some of her experience with us. I'd thank you, Dayle, for joining us today.
Thank you for having me.
Talk about the mission of the organization and how you ensure that people in the Duluth area have really good and holistic health.
Lake Superior Community Health Center has been around since 1972. We started as a free clinic in the basement of the Sacred Heart Church. Our mission has not changed. What we do and how we do it has changed a lot over those 50 years, but our mission has not changed. And that is to make sure that everyone has access to certain primary health care, regardless of ability to pay. So we started as a free clinic with primarily volunteer providers and donated supplies, and we've grown over the years. We added dental services. We've expanded to add behavioral health. We have a clinic now in Duluth and two clinics in Superior. We offer primary medical, dental, behavioral health, and in Wisconsin we also offer substance abuse services. So what our mission is to make sure that everyone can have access to health regardless of ability to pay. We have a sliding fee scale, we have fully integrated care, and we're very intentionally inclusive, reaching out to groups of people who are frequently marginalized in our society to make sure that they know we're here and that they feel welcome coming to us.
There's a values-based and a philosophical element to this. Mm-hmm. Whether it comes from one value tradition or another, it really is about how you see society. How do you see a healthy city? Could you talk a little bit about how the people who support you, the people on the board, people on staff, your volunteers, how do they see a healthy region?
Right. Well, the interesting thing is that we're a community health center, or what's called a federally qualified health center. Mm-hmm. FQHCs have their roots in the civil rights movement from the 1960s. So a physician by the name of Dr. Jack Geiger had done some traveling and came back to the United States and said, there's this concept of having a community health center embedded in the community, and that health should revolve around and emanate from that idea that as a community we should care for each other. And through the Johnson War on Poverty, was able to get funding for the first two community health centers. So it's all rooted in this idea that health is a basic civil right.
And it's a community.
And it's a community, that our community should rally around people. And so there is a feeling among federally qualified health centers, community health centers, that is all about the patient. Our board of directors is comprised of at least 51% of our board must be patient members of our board. We have a lot of initiatives that focus on patient feedback and making sure that we're being, as I said, intentionally inclusive. And the whole concept is, what does our community need? We regularly and routinely conduct needs assessments to see what our community needs. So there's that idea that we're here to serve the community, tell us what you need, and then can we figure out a way to do that?
And in their initial manifestation, these health centers, these clinics, were really about physical health. But now it's a much more holistic piece, right? And it's not only physical and mental health. Whether there's a division there is debatable, right? It's all one person. But it's also things like preventive and diet and attitude and how one behaves. Right. Could you talk a little bit about how you see that aspect? Because it's not just giving a shot or fixing an injured arm. It's much more.
Right. So we really do believe that patient-centered care, whole person-focused care recognizes that what happens in your head, your mental health, is connected to what happens in your teeth. Your oral health is connected to what happens in your heart and in your liver and in your spleen and your pancreas.
Your diet,
Absolutely.
Your exercise.
They're all connected, right? There's really interesting research coming out having to do with some of the trauma-informed movement and other kinds of studies that are showing that there is as much impact on physical health of social isolation as there is on smoking 15 cigarettes a day.
So social isolation meaning that you are staying in your home, you're staying in whatever your shelter is, you are not communicating with other people, and that actually has a physical manifestation.
Right. So the great thing about Lake Spirit Community Health Center is that we have this integrated care, right? So if you come to our clinic, you can see a medical provider for primary care. You can also see the dentist. Those two people can actually speak to each other. We share a common medical record. If you have a behavioral health condition, you can see a behavioral health clinician. And again, those providers are going to speak with each other and work together to treat the whole patient. And so it really is that idea that everything has to be in alignment. Everything has to be considered for health to be whole.
How do your dentists, your doctors, your nurses, how does this affect the way they interact with one another as a team?
So I have a couple of examples that I think will answer your question. So we had a patient recently in our dental department needed some dental work done before the patient could have some very important medical intervention for a very serious, potentially life-threatening disease. Ended up in our dental chair, blood pressure so out of control that it was not safe to treat the patient. So our dentists recognize that if we can't get the blood pressure under control, we can't do the dental work. If we can't do the dental work, they can't engage in the therapy they need to treat this life-threatening disease. So sent the patient up to see one of our primary care providers, was able to get the blood pressure under control. So in fact, the dental procedure could go on. And we have all kinds of examples of that, is that we can't see these things as discrete factors, but we have to take a look at how it impacts the patient as a whole.
What's really interesting is that we're getting back to, through these FQHCs, we're getting back to a concept of medicine that we kind of lost when we moved into this sort of science-based specialization, right?
Right. Remember, for some of us who grew up in rural America, like I did, remember the old family physician?
The doctor with the,
exactly.
the black bag and would open up like this.
Yep.
And they would, yes.
We had Dr. Palmer when I was growing up. I think he thought penicillin cured everything, because I remember getting a lot of that. But he treated me from the time I was a baby until I was in high school, knows everything about you, knows everything about you. And I'm not saying there was never a time that they sent you to see a specialist, but there was that whole person approach. They knew your family history, they treated your family. And so, we've come so far, as you say, in these silos where we have people who, thank heaven, specialize in things like neurosurgery and orthopedics and rheumatology. We're glad to have those specialists, but we've lost some of that idea that it's an integrated approach.
You get also to the, with the over-specialization, you lose so much. So, for example, if you take a look at the heart and then the vascular system, and then you take a look at the pulmonary system, the whole breathing apparatus that you have. You take a look at neurology. All of these elements, connective tissue is ubiquitous. All of these elements actually exist together. To the extent that we're talking about point solutions, we get really, really bad impacts. Nowhere is that more obvious than through the problem of addiction that we have, where people are being prescribed drugs that, because of a lack of communication amongst people, others in the profession, prescriptions are, certain substances are being overprescribed, and that creates other harms, like the opioid addiction. So we do provide outpatient substance abuse services in our Wisconsin program, and we have a medication-assisted treatment program where we can provide people Suboxone in conjunction with other services. The majority of the time, the patients that we're serving in that population have other co-occurring disorders. It might be a mental health issue, it might be a primary care issue. So you talk about, for example, how do we treat the whole patient? Let's talk about someone who has a long-term addiction to meth, for example. Meth is extremely hard on teeth, and it causes severe degradation of the erosion,
teeth.
Right.
So let's talk about someone who has made the Herculean effort to get off methamphetamines, because it's a tough road, and they do, and now they want to go get a job. How do they get a job if they have a mouthful of teeth that make them not presentable in a customer service kind of world. So our ability to understand how those things interplay and how maybe getting a patient dentures or some type of corrective dental procedures could have a significant impact on their ability to complete and successfully maintain the work that they've done in a substance abuse program, because gainful employment is going to have a significant impact, and you can't be gainfully employed if you are not fitting a certain societal mold about your appearance.
And if you take a look at the competencies and how that splits up of your 99 people, how many are in different disciplines?
Mm-hmm. So we have about 5 medical providers, not all full-time, 7 dentists, 9 behavioral health providers, 3 substance abuse providers, and then we have dental assistants and medical assistants and hygienists and so on and so forth. So approximately about 40% of the services that we provide are primary medical, 20% or so are behavioral health, and the rest are dental.
And how are you funded?
So we have multiple sources of funding. Our primary payer is going to be Medicaid. We serve a lot of persons who are enrolled in the Medicaid program. We also serve persons on Medicare, so we have that funding. We receive what's called a federal 330 grant, which is offered to federally qualified health centers. Because we offer people a sliding fee scale if they meet income guidelines and they're either uninsured or underinsured. So that federal grant helps support us in the provision of care. We're also really fortunate to have some great local funders. We've had many years of funding from the Ordine Foundation, from Duluth CDBG, the United Way. We recently received a grant from the Miller-Dwan Foundation to support a brand new program to provide free telephonic mental health support to farmers and their families because of the crisis of mental health and the unfortunate increase in suicides among farmers and their families.
If you were to look further out, 5 years and 10 years, how do you see the organization evolving over the next, let's say, 10-year horizon?
I happen to have children who are young adults, and they won't communicate with me unless I text them. So I think one of the things we have to ask ourselves is, what is the communication style that the next generation is going to insist on? So I think there will be lots of changes dictated by the people who are using the system. As you get older and you have more chronic conditions, that face-to-face appointment with a provider, that personal relationship with the provider starts to become more important. If you're in your late teens, if you're in your 20s and your 30s, and you're fortunate to be a really healthy young adult, your interaction with the healthcare system is much more episodic. And for those individuals, what's going to matter to them is, how can I get seen really quickly? Can I make the appointment on my phone? Will someone even talk to me over the app? Can I do it on my lunch hour? And we have to be thoughtful about that. What are the ways we connect with different people at different points in their life that is appropriate to the type of care they're asking for or that they need?
So it's customer responsive provision of health care.
Right.
It's customer responsive, it's patient responsive. Dayle Patterson, thank you so much for sharing all the great work of the Lake Superior Community Health Center, and thank you so much for your insights.
Thank you for having me.
Welcome to Insight, produced in partnership with WDSE and WRPT in Duluth, Minnesota. Today we are chatting with Tiffany Schleppegrell, Executive Director of the Project Care Free Clinic. Tiffany has generously agreed to share some of her experience with us. I'd like to thank you for joining us today.
Thank you for having me.
Talk about the ideas surrounding the establishment of this free clinic.
So Project Care Free Clinic was established to help those people who are uninsured, which we all know those people need help, but also underinsured. So a lot of people have insurance, but they have a high deductible plan, and for basic medical care they would avoid going in because they can't afford it. So we do a lot of basic, sinus infections, colds, stuff like that, but then we also work in partnership with the hospitals to do lab services and x-rays. So our 3 most common conditions that we deal with are hypertension, diabetes, and mental illness.
So hypertension and diabetes are very often associated with age. And if that goes untreated because you cannot get the appropriate tests done, that could lead to really severe conditions that must be treated at a much higher cost.
Yep, so one of the things that we do with our diabetic patients, besides providing them with free insulin and testing materials, is that we strongly encourage them to meet with our diabetic educators. And these are providers who are already providing that service up at the hospital, and they come after working all day to spend time with the patients to help them get things under control and more of a management plan.
And part of this has to do with behaviors, because in diabetes in particular, since you're dealing with blood sugar, your diet and your level of exercise has a real connection to whether you will suffer some sort of an episode. And of course, even if you don't suffer a particular episode, lack of appropriate blood sugar levels creates physical harm over the long term.
Right, a lot more serious conditions that require a lot more care that will be a lot more expensive for someone to deal with. So it's really important that they meet with our educators and get a treatment plan going so that they don't have to experience some of the more difficult aspects of the disease.
Now, you mentioned that you serve people who are uninsured and also underinsured. What is the ratio of people who are underinsured versus people who are uninsured, completely uninsured?
So 60% don't have insurance and 40% do have some form of insurance.
And what is the cause for people not having insurance? Is it a matter of employment instability or lack of means?
You know, that's a really good question. And one of the most surprising things when we look at our numbers, 89% of the people that come to Project Carefree Clinic are working a full-time job. So there's a lot of employers who don't provide insurance. A lot of people choose to not buy the insurance because it's unaffordable. And another surprising thing is that the largest group that's coming in are people 55 plus, because people in that age group have deductible, or, you know, if they're paying their monthly premiums, it's $1,300, $1,500, $1,600 a month, and it's something they just can't afford.
What's so interesting about these numbers, 89% of the people coming in are working full-time jobs. These are people who want to be employed.
Right.
Right? And the money that they make is paying for their day-to-day needs. But as soon as a healthcare event occurs, they have no funds to pay for it. And so many people can't afford even the basics of health insurance if they don't get it through their job.
Right, so many people are just kind of in transition between jobs, or it's unaffordable. They own their own business. One spouse isn't working, something like that. So they're kind of rolling the dice, and then something happens, and that's where we're filling that gap.
In terms of the people who are underinsured, is it mostly the high deductible issue?
Yep, it's the high deductible. You know, there are some plans right now that have deductibles as high as $12,000. So it's basically like not having insurance at all.
So how does this work? When somebody comes in, do they just show up and then they get whatever test? Do they make an appointment? How does that function?
We are a mostly walk-in clinic. We're open from 5:30 to 7:30 in Hibbing. Mondays and Thursday nights, Virginia, Minnesota on Wednesdays, and Grand Rapids on Tuesdays. We ask that people bring a photo ID. We don't ask that people provide bank statements or proof of anything. We're taking people at their word, which I think is a little different than some other programs work. A lot of people aren't able to produce all those documents when they're not feeling well. You'll come in. You're greeted, you're asked to fill out some forms. You'll be put in a regular exam room. A nurse will take some vitals and talk to you. And then we have a wonderful group of doctors who come down after their regular workday, and they'll come in and meet with you and decide what you need. If you need an x-ray or a lab, they'll send you up to the hospital, and we'll get those results and we'll get some medication for you. If paying for medication is an issue, we do have some great relationships with pharmacies in town. And we also work with the Good RX program, which finds reduced drugs to work with people. For diabetics, we've worked with Eli Lilly, has a Lilly Cares program that will pay for your insulin for a year. So another big aspect that we do at Project Care is advocating for the patient. So There are a lot of things that we can't do for people, and there are a lot of people who come in and we find out that something's happened that is a major deal, cancer, some kind of surgery is needed, and we really stick with the patient throughout the whole process and work together with patient financial services at the hospital, try to get them on some kind of insurance plan to get them to the next step.
Very frequently when you go, anybody who's got walked into the hospital, they have to fill out a lot of forms. And you get the impression that it's about the hospital being paid. And that's true, that's part of it. But in your case, it is really about following the patient and ensuring that you are assembling enough data for your work, that you know who the patient is and what their treatment is, and you can interact with your partner institutions. It's not really about billing. It's about trying to figure out how to do the right thing for this patient.
Right, all of our forms have a reason, and most of those reasons are to gather information about our patients. And the other part that we use a lot of that information is for filling out grants. And we are supported by the Northland Foundation here in Duluth, the Duluth Superior Community Foundation, the Hibbing Foundation, the Grand Rapids Foundation, the Virginia Foundation, the United Way of 1,000 Lakes in Grand Rapids, and the United Way of Northeastern Minnesota. So they all like to know what they're spending their money on.
And in terms of the work that you've done to connect people to, for example, supplies of insulin, one of the big issues that we've seen recently is that the price of insulin has increased dramatically. So talk a little bit about how that has affected your clients and how you've tried to ameliorate that through these types of partnerships.
So we've had some pretty, just like the other horror stories you hear on the news about insulin, we had a waitress who was sharing insulin with her sister. We had patients who were just going without. And so it's really important, and we've been seen as a resource in the community too. We've had people get sent down to us from the hospital. We'll provide them with insulin, but we'll also go to the next step with them, not to be your total provider, but to hook you up with the Lilly Cares program or get you some insurance to get you to the next steps.
In terms of the drugs and other substances that you can prescribe, we've seen in the last years an overprescription issue with particularly opioids and addictive drugs. How do you manage that to ensure that people are not coming around and doing drug shopping?
So we actually don't provide any opiates at our clinics, and we have big signs up that let people know, so word of mouth gets out that we don't have those either. We don't, anything serious like that will help you find another resource to go to. So part of our mission statement is to connect with other places in the community that could help you. So we would refer you to someone that could help you with those kind of issues.
And you serve how many patients annually?
We had 1,800 patient contacts last year. So that means from visits to follow-up phone calls throughout Hibbing, Virginia, and Grand Rapids.
And you also absorb about 3,000 volunteer hours annually.
Oh,
as well.
We have such excellent volunteers. So besides the doctors, nurses, people who do reception, we try to do active things in the community. So we're in parades, we're volunteering in other parts of the community. So we have a great group of volunteers.
Now you also do free immunization?
We do. We do free immunizations for children and adults in Hibbing at the first of the month. We encourage people to call in and make an appointment to get those done.
And you also talked about how you help people navigate the insurance processes, but you haven't yet talked about sports physicals.
Yeah, so we get really busy at back to school time. We're real popular with college students. They know us down at the college. Kids who want to do sports, we do sports physicals. The high school and middle school kids too. It gives them a great opportunity to get checked out to play sports because it's a $150 office visit that their parents don't have to pay.
What is your budget?
We run all three clinics on $150,000 a year.
That's just incredible. $150,000. And what is that generally used for? If you were to take that money and you were to say how that money is spent, how is that money spent?
Our biggest expense is our staff. So we have one full-time staff person, that's myself. And then each clinic has a site coordinator, and they work around 20 hours a week. And they do the scheduling with the volunteers and follow up with patients and make sure that people are showing up at the tests they're supposed to show up to. That's our biggest expense. We're so lucky we have free rent in Hibbing. We have free rent in Grand Rapids and a small rent in Virginia. The rest of our money goes towards supplies and medication.
Tiffany Schleppegrell, thank you so much for sharing with us this wonderful, wonderful series of programs that you manage through Project Carefree Clinic, and thank you so much for your insights.
Thank you.